Audio Jungle.
Hello, good afternoon. It's Dr Achmed Kamara of Doctor to You here. I hope you're all doing well. It's been a while, and I just want to share with you a very interesting scenario that I came across in clinic today. So I saw a lady who was 41 years old, and over the last 5 years had a lump on her left shoulder that had been slowly growing over the last 5 years. It's now causing her a little bit of a discomfort, but more importantly, it's now quite obvious, so other people are noticing it. And that was the main reason why she presented. She was so keen and desperate to see a doctor face to face, but I reassured her that we can deal with this on a video consultation. And during the consult, of course, I asked, I took a careful history, asked a relevant question about how long the lump had been there, how quickly it had changed in size, whether there was any pain, any discharge from it at any point at all, and whether she had any other lumps in the surrounding region, for example around her neck, and whether she had any difficulties raising her arms, moving her neck, etc., etc. The questions are many, but you need to be able to ask them in order to deduce what's causing the lump. I reassured her that through the video consultation we can actually get an even added idea of what's going on. So she logged on to the video consult, and I was able to observe a very obvious lump on her left trapezius, so just about here on the shoulder. I asked her how it felt when she laid her hands on it, and she said it felt a little bit soft but firm. Now, with all of this, I put together that the most likely cause of this lump is a lipoma, and reassured her that that is what it is, most likely, but we'll get an ultrasound scan just for confirmation. Now, this management plan is unlikely to have changed had I actually seen her in person, but I was able to reassure her, and we'll get the ultrasound scan done, and it'll be really interesting to see what the result shows, and hopefully it will be a lipoma. A lipoma is a benign soft tissue growth. It's actually an overgrowth of fat cells over an area of the body. It can happen pretty much anywhere on the body, and most of the time nothing is done about it. There is a significant chance that taking it out, so excision surgery, will actually only result in it reoccurring again at some point later on in the future. So usually nothing is done as long as it's not causing any localized pain, it's not pressing on any nerve and causing localized symptoms or discomfort for the patient. I mentioned that this patient actually came to see me today on the video consult because it had become obvious and other people had been commenting about it. Now, this of course can cause some psychological disturbance for patients, so that is also another reason why a lipoma might be excised. Well, look, I hope you've enjoyed that breakdown there, and I just really want to get across what we do at Doctor to You and how much we can solve, how much we can diagnose and reassure patients through a video consult if the right person is dealing with you, asking the right questions, and observing you in the right way. Wish you all the best. Look after yourself and continue to engage in looking after your health and being the master of your own health.